Hi, I'm Hani from Activate Clinic, and today we're going to be talking about lower back pain. Lower back pain is one of the most common conditions that we see in our clinic, and we've had a lot of issues because a lot of people that are coming to us with lower back pain have their doctors have sent them for medical imaging like X-rays and CT scans, which come up with some sort of disc disease like disc degeneration, disc herniation, or disc bulging, or something like that. And all of the time, people stop there as a diagnosis, and then the usual course of treatment after that is something like massage or cortisone injection, even surgery sometimes, things that are very passive in nature as a treatment option, in medicine, right? So, but what we've seen is that usually disc disease or problems with the disc is not the actual cause of the problem, but it's an indication that there are muscles that aren't doing their job. So just to explain that, if we just held your bones, your skeleton with no muscle, and we held it up and then we let go, everything will come crashing down to the floor. So the force of gravity will be too much for your bones to withstand by themselves. And the only way that we can stand upright without collapsing is that we have a big web or network of muscles, and their job is to resist the forces of gravity or resist any external forces that we put our body through. So usually when there's disc disease or lower back pain, most of the time it's related to one of the muscles or multiple muscles not doing their job properly. And the way that that happens is either a muscle is too weak and just can't handle it. The other option is that maybe it doesn't have enough endurance, so the muscles can they can work, but not for long enough, or they can't last the length of duration that you require for your whatever your activity is. And the third possibility is that some of the brain isn't switching certain muscles on for some reason, and just the order of muscle activation is off, and that's what causes this problem. So, but the good news is that you can fix lower back pain by working on your muscles and getting a little bit stronger and building up your endurance and just connecting your brain with the key muscles that are involved with lower back pain. So what I'm going to do now is show you a generic progression from easiest to hardest of some exercises that target these muscles. So just make sure that you understand that there's a lot of different exercises out there, and there's a lot of different muscles that may be involved. So it's really important to actually try to figure it out for yourself to make the most efficient program. So we would love to help you do that. So if you're interested in a bit more detail and a bit more specificity to you, just send us a message or get in touch with us somehow, and we'd love to do that for you. So, but generally, here's a progression of exercises for you, correct? So the first one is pretty simple. It's just getting, there's a muscle here called TA, and it's just trying to switch that on and practice having that muscle on. So there's two ways to do it. So the first way is just to draw your belly button in as tight as you can, and that tightens that muscle. And if you can hold that while breathing, so belly button in and breathing, about 10-15 seconds, and then you can relax. And practicing that more and more, sometimes you'll find that you feel a bit short of breath at first, and then but as you do it, you'll get better at it. And the second version of that, which is a little bit more tricky, especially if you're doing heavy lifting or anything heavy, is you stick your thumbs into your sides here, and you push out like you're going to the bathroom. So you push out, and you'll feel the muscle push against your thumbs, and all you're trying to do is sustain that push out from your belly against your thumbs, and just keep breathing without losing that contraction. The next exercise is an abdominal hold. So you're going to lie on the floor, and you can put your hand beneath the small of your back for feedback, and you're going to lift your legs, and what you're concentrating on is pushing your back down against your hand and just holding that pressure down and just breathing as normally as possible. And the next one is a same kind of hold, but now we're going to make it a bit more complicated with some leg movements. So still thinking about keeping the pressure with the small of your back down into the floor, and then slowly moving your legs and trying to resist your back lifting up off the floor, still trying to maintain your normal breathing. And then next we have a reverse crunch, which is a more advanced version. So again, you're going to set up the same way with your feet up in the air. Again, pressure down into the floor, and you're going to try to extend both legs out this time as far as you can. And again, I'm concentrating on not lifting your back up off the floor, and just try to keep your breathing as normal as possible. And if your back starts to lift, then you have to stop the range there. So that's it. And then the last one's the hardest, is a plank. So yeah, on the other way facing the floor this time, and you can lift up on your elbows, your forearms and your toes. You can do it on your knees, it's a little bit easier. And then again, just trying to breathe. If you feel pain in your back, then you have to stop. That means your core has given up. So until you go as long as you can until you feel your abs are done. So thanks for watching the video. We really love to help people get over back pain. It's one of the best things that we love to do. So if we can help you, then check out this link that we've made for this video, and we'll give you some free exercises and be able to help you out a little bit more. So thanks for watching. Have a good one. All the best.